All right, good morning. I can't tell you how excited I am to be doing this. Is personally my first webinar and talking about a topic that is near and dear. So I really thank everybody for joining on, and those who could not will get an opportunity to view the slides and the presentation at a later date. So I think the reason why all of us are here today is because we want to know how to best care for ourselves and be our own advocates in a hospital setting. So to help people affected by Parkinson's understand the risks that are associated with a hospital stay, because of the disease, there are some other risks that can happen with staying in the hospital. Getting the needed tools to play an active role in your care. Being prepared for the hospital visit, whether it's planned or unplanned, and we'll talk about the Aware and Care kits. Develop strategies to get the best possible care while you're in the hospital. So the Aware and Care Advisory Committee is a committee of 6. We're comprised of clinicians and members of the Parkinson's community. Our role is to advise on the content and disbursement of the educational materials, and specifically the educational materials that are part of the Aware and Care initiative. And the goal of the Aware and Care initiative is to make hospitals a safer place for Parkinson's patients to be. So I'm Debra Mayer. I'm actually a registered nurse specializing in critical care and emergency nursing, and for the last 12 years I have held a tenure position as nursing faculty on Anoka Ramsey Community College, which is in Minnesota. We're part of a baccalaureate nursing program. I'm sorry, I skipped a slide here. So how did I get involved in this? Well, in 2018, I was selected to participate in the Edmund Safra Visiting Nurse Faculty Program. It was put on by the Parkinson Foundation. It was a combination of writing a letter of interest and then being invited to attend. And through that, I became involved in the Aware and Care Advisory Committee. So, you know, we all think hospitals are safe. I'm a nurse. I've worked in a hospital for years, and in general, you just think a hospital is a safe place to go. When you get there, they're going to take care of you, and they do. But there are some things, you know, in particular for Parkinson's patients, you would assume that if you have a neurologist involved in your care, that they would be notified that you were there. And that the pharmacy would have your Parkinson's medications in the pharmacy where they would have access, and that you also would assume that staff understand your Parkinson's disease symptoms. That's not always a true fact, I guess. And you know, along with them understanding is that, you know, your assumption is that you'll get your meds on time, and that they will automatically know what drugs aren't safe for you to take in the event that you would need something different than what's on your medication list. So really, approximately 1/3 of people with Parkinson's are hospitalized every year. Of those who are hospitalized, 3 out of 4 don't get their medications on time. And when that happens, 2 out of 3 have complications that should have been avoided. So this means that about 16 out of every 100 people with Parkinson's will have unnecessary complications. I think the biggest one that I can think of is falls, and then, you know, return of some of your symptoms. So it's really an important thing to know how to advocate for yourself when you're in the hospital. So people with Parkinson's are hospitalized about 44% more than their peers. People with Parkinson's suffer avoidable complications at a higher rate, and this then in turn means a longer hospital stay for those patients. So the biggest thing as a group, you know, we tried to decide why is this happening for sure. And even the best hospitals, there is a lack of understanding, or can be a lack of understanding amongst the staff about Parkinson's disease. Non-Parkinson disease specialists may not be fully aware of the critical importance of your medication timing. So for example, the physicians, the hospitalists, or the physicians who care for patients on the floors in the hospitals do not have a specialty in Parkinson's, and don't fully understand themselves about your medication timing. Hospital pharmacies may not stock all of the Parkinson's medications that are out there. So those who have different or some of the new medications, it may be difficult for the pharmacies to even have them in stock. Hospital staff may not know that many common medications that are used for other patients in general and are considered safe for other patients are not safe for the patient with Parkinson's. Even things as simple as medications used for nausea. So those things are all very important in the teaching so that you get the best care and the best hospital experience that you can. 70% of hospital staff are unaware of the drugs that worsen Parkinson's disease motor symptoms or are contraindicated in people with Parkinson's. So my role, and one of the reasons why I went to the training with Edmund Safra, is so that I could come back and work with nursing students who then would have a higher level of understanding of Parkinson's disease and how important it is that medications are on time, all of the time, and understanding what things that you shouldn't be given during your stay. And this national program we have reached a lot of nurses across the United States, and so it's been very important. Other countries as well. Lack of awareness. One of the critical importance of Parkinson's is medication timing, and it's not that nurses are too busy or think it's not important. It's just that it's the not knowing how important that it is for timing with your medications. So many common medications for pain, nausea, and depression, and some of the psychosis types medications are unsafe for people with Parkinson's. So that lack of awareness then can cause an injury to the Parkinson patient while they're staying at a medical center. Poorly managed Parkinson's might result in mental confusion and other serious symptoms. So mental confusion based on drugs that maybe shouldn't have been given to the Parkinson's patient while they were there. Also, not getting your normal medications on time can increase your risk for falling and for confusion. At any point in the slide presentation, if you have questions or want to interject or have an experience that you would like to share, if you can take it put your little message in the chat room, and Amy and Carolyn will kind of field those things. So Parkinson's patients and their families generally enter the hospital system from one of two ways. It's either a planned admission. So for example, you're maybe being admitted for a planned surgical procedure. The rest of the Parkinson patients generally come through emergency admission. So you might come to the hospital by a first responder, so like an EMT or a paramedic comes to your home, or you come through the emergency department and you're seen by emergency nurses and physicians. So really, Parkinson's disease is not often the primary reason for being admitted to the hospital. Frequently, and actually most of the time, it's part of your medical history and that you're being admitted for something other than your Parkinson's disease, like for example, abdominal pain or a surgical procedure that you've planned, things like that. So providers oftentimes lack the necessary Parkinson's disease expertise. They recognize it as one of your current medical conditions, but really don't have the expertise in Parkinson's disease itself. Medication regimens are often complex. I mean, many of you know your medication regimens at home. Everybody's are not the same, and oftentimes you vary your medication regimens based on needs or a new med and things like that. So the regimens are complex, and medication changes or changes in your timing can then negatively affect your outcome. Oftentimes when a list of medications goes to pharmacy, the medications are kind of put into your record up on the unit based on generic timing. So oftentimes Parkinson's medications need to be specifically timed so that they mimic what you do at home. Parkinson's patients also often have complex mobility issues, and everybody's mobility is different. Issues are different. Some days are better than others. Sometimes, depending on how you feel. And so there's already that higher level of risk for falling. And oftentimes this isn't, it's not overlooked, but it's not really brought to the forefront so that everybody realizes that it's a special high risk. So medication challenges. Multiple medications are used to treat Parkinson's, and contraindicated medications are often not recognized. So I know we keep coming back to this, but I think it's just truly one of the most important pieces of your care, and making sure that you're getting quality care while you're in the inpatient setting. Changes in timing and dosing can affect your status. Oftentimes nurses don't understand kind of what really happens when your medications aren't given on time every time. Compromised swallowing then is the ability may dictate changes in your medication formulations. So obviously some of you may have swallowing issues, others don't, and there again swallowing issues can kind of vary based on other things that are going on, as well as some medications are just plain harder to swallow than others are. So you may need some special things in place when you're in the hospital setting for swallowing issues. So, it seems like this problem should be just really so easy to solve. But it's just really comes down to the complexity of medication regimens, and also then the medications that you should avoid while you're there. So, there's more frequent dosing of Parkinson meds than there are other kinds of medications. Default schedules, which I just kind of touched on, aren't typically appropriate. Some medications default to twice a day, 8 and 8, or twice, 3 times a day, 8, 2 and 8, or something like that. And that doesn't work for Parkinson medications. So they really need to be kind of put in on a patient-by-patient basis into your medical record so that the timing is appropriate. Non-specialists are unfamiliar with the crucial differences between different formulations, and obviously sometimes the continuous release versus an immediate release medication, the generic versus the brand names, and some people cannot substitute one for another. And there is a big difference between continuous release and versus immediate release. So those little pieces of your medication regimen really need to be understood by the staff that's taking care of you. Oftentimes you need kind of a mix of your medications and in order to fully stabilize fluctuations in motor abilities. You are your best advocate, and your family is your best advocate when it comes to making sure that this is understood by, so that everybody in the facility can take care of you appropriately. Everybody wants that, and so it's just a matter of educating every time you come in to a hospital setting. So a lot of staff, and nurses, pharmacy, physicians, we use an electronic medical record primarily, and the culture is that, and the thinking is that it's what is in the electronic record is faster to get at, and also many people think that that's like the most up-to-date, the most appropriate information, it's always correct, and things like that. And that's not always the case. And so your outpatient medication list, or the outpatient medication list is not often specific to timing, and it can contain errors. So when you're in a clinical setting, you go to the clinic and they ask you about your meds, and they kind of go through the list. And I don't know if anybody else has ever experienced this, but oftentimes there's errors in your medications or in how often you take them and things like that. And it works the same in the hospital setting. You come in, your list gets pulled up, and there frequently can be mistakes. So what the patient does at home is how it needs to be ordered in the hospital. And so coming to the hospital with a specific list of your medications, how they're timed at home, how you combine them at home, how they're given at home are really important things to have. It's essential for the accuracy of your electronic medical record. Anti-Parkinson medications are as necessary to a Parkinson's patient as insulin is to a diabetic. And so we try to equate that because people understand how important it is for diabetics to have their insulin. And it's in the nurse's perspective, it's always in the forefront of their mind that, okay, I got to get their insulin. They need their insulin now because it's mealtime, it's breakfast time, it's lunch time. But often Parkinson's disease medication schedules are changed in the hospital. This change may result in greater risk for disability and consequently an increased risk of accidents and other complications. So the acute discontinuation of Parkinson's disease medications can be life-threatening. And so always making sure that when you look at your list of medications in the hospital setting, that everything is there, nothing's been discontinued or dropped off your list, things like that. So I think medications are the biggest deal. I think behind that comes mobility challenges. Every hospital has, fall precautions and ways to screen patients for falls and things in place. However, I think with the Parkinson community, the mobility challenges are different. And Parkinson's patients should mobilize as early and as often as their conditions allow, rather than having you stay bedbound or chair-bound for big periods of time. Early mobilization is so important in order to keep you, everything working right and the rigidity symptoms down to a minimum. Ambulation reduces the chance of worsening rigidity and associated symptoms with that. And Parkinson patients are at a heightened risk for falls, which we've already talked about. Patients and care partners should discuss risks associated with lack of movement with the physician and the physical therapist. And if a physical therapist has not been assigned to your care while you're there, you need to request one. They will be your biggest advocates in terms of your mobility challenges. They're also a good person to come back to the rest of the team and with more explanation about the use of equipment and what types of mobility issues that you may be having. So physical therapy always is one of your best advocates while you're in the hospital setting. So the role of the patient and your care partner, your wife, your significant other, whoever it happens to be who actively is involved in your care. Each person with Parkinson's disease has the best knowledge of their disease and their conditions. And so this is very powerful for you as a patient coming into a hospital because you do know the most about your disease process, your other conditions, your medications, your mobility, and you all have a unique combination of medications and a listed regimen. So good, accurate medication lists and information that you can teach to the staff is a very powerful place for you to be when you go in there. Each person with Parkinson's disease is most knowledgeable about their own special needs, but may have communications challenges. So there again, being able to communicate, whether you're having trouble with word finding or just a soft voice, communicating your special needs can be a challenge if there's some issues with communication. So care partners can have all of the above information and then advocate for their Parkinson's loved one's care. I have, my father is a Parkinson's disease person, and he, for about 15 or 18 years, and my mother has learned very quickly, early on, to be his advocate when he was anywhere, the eye doctor, the clinic, the hospital setting, at church. So people really do like to know, and people have a lot of questions who oftentimes maybe are not comfortable asking, or but I think if you can as a Parkinson's person be able to share this information, and if your care partner can as well, I think it just educates everybody around you and makes for much better experiences. So Aware and Care is our name, and we're here to help. It's the Parkinson Foundation's Aware and Care campaign. The whole idea is that everyone is better informed. So people with Parkinson's, your care partner and your family, hospital and facility staff, healthcare providers. The Aware and Care Kit helps patients and families plan for hospital visits and advocates for the best possible care during the stay. Now, I don't know how many of you are know anything about the Aware and Care kits yet, or if you actually have one of your own. We'll talk about those as we go along, and how you can get one if you don't have one. So let's talk about what's in the kit. And this is, over the last several months, we have actually looked at the kit, broke down the kit, changed things, made things more streamlined. We're still continuing to work on it, and then taking it back to people in the community with Parkinson's and their caregivers. I haul it over to my mother's every chance I get and go, okay, look through this stuff again. What do you think? Because it's meant to be for you and for your caregivers, to help you have a better stay, whether it's planned or not, in a hospital setting. So we're going to look at each of these pieces of the kit. There are several things that we've been working on. You can see there's a medical alert bracelet, and we've been kind of actually playing around with other options that are, look maybe a little more dressier or fancier, however you want to say. But there's also a medical alert. There's a card in the kit. There's another kind of a little two-sided card that talks about I need my Parkinson's medications on time every time. It's a great little card to give to like staff and people like that. There's a medication form. There's a fact sheet for nurses. And so we're going to go through each of those things. So the right medications on time is one of our really big pushes. On time, every time. And so this card has just some information on it. It talks about needing your medications on time, every time. And there is a number and a website that can be used for the staff nurse in particular to get more information about the process. There are also then on the back side of this, it talks about medications important things for the healthcare person to know, what to give, what not to give. And so, for example, no contraindicated medications, and there's a list, and never to give Haldol. So that's one of the things in the kit. So the kit bag then, along with the aware and care materials, let me back up for just a minute. I was thinking I had a few more slides, and maybe I do further down. But the medication forms, there are some pull-off medication forms that you can hand off to the staff. There's also some larger forms. We were trying to consolidate some things down, so it's here's my meds, here's my schedule, here's how I take them, here's the things that I can't take, here's what you should avoid giving me, because these medications, like for example Haldol, which is a pretty common medication in the hospitals, and it's a very bad medication then for Parkinson's. So there's a list of don't give me these, and then there's a list of these are safe for Parkinson's patients. So it's really good information for the nurses to know, and they can pass that on then to pharmacy and to the physicians. The fact sheet also gives a lot of great information about Parkinson's in general. We've really kind of tried to refine everything down so that it's good information that's easily accessible for the staff to look at. So now you've kind of seen the pictures. Here's a little bit more about the kits. So it's a kind of a little kit bag. It's not very big. It's actually perfect for, it's got all the stuff in it, and then you can also put your current medications and supplements within the original bottles in the bag as well. This is particularly important for medications that maybe are new medications on the market, or something that the hospital may not have. Every hospital is different. Some will allow medications from home, some will not, but pharmacy is very interested in knowing exactly what you take, so having things actually in bottles is very helpful. The hospital action plan is for you personally to read about how to prepare for your hospital visit, whether it's planned or an emergency. So your hospital action plan is going to have information about you, your medications, all your pertinent information. It helps, and then there's steps to it that helps you to make sure that you're ready if you were to go like for a scheduled hospital stay. But also, if you fill the hospital action plan out, you're able to pack it away in your kit bag, and then it's ready for, say, an unplanned hospital stay. Like, for example, maybe you have a fall with an injury and end up having to go into the hospital unplanned. So you've got your kit bag is going to have everything in it for you. The ID bracelet, to be worn at all times in case there's an emergency situation and you cannot communicate. So we're, like I said, we're kind of working on bracelets and looking at different styles and things like that. Trying to see what's out there. The medical alert card, you fill in with your emergency contact information, and you can place that in your wallet. It also on the card specifically says that you have Parkinson's disease, and then it gives whoever needs to go through your wallet for any reason information about emergency contacts. There's also the medication forms. These are just the best thing, because you keep up this form with all of your up-to-date medications. So fill out the form once and then make photocopies of it. And then as long as it stays up to date, you can just continue to use the same copies. You can complete and print additional copies of the medication form from parkinson.org /aware-and-care. In fact, there's a lot of free things on that particular site. So we'll kind of talk about that towards the end. But your medication forms are probably one of the best things you can do for yourself, and because you can just hand it off to the nurse. They can reconcile your medications and make sure not only that they're all on the list, but that then the timing is correct. nurse disease fact sheet pad. So this is just a kind of a little tear-off pad, and you can share the facts about Parkinson's with every member of your care team. And there's a pad of them in the care kit so that you can pass them out to everybody. Physical therapy, all the staff that comes into your room, your pharmacist, the physician. It's very useful information. There's also a magnet, and this magnet is to display a copy of your medication form in your hospital room, so you can, attach it to the wall there. The other place that some people use their magnet is on their own refrigerator at home, with their copy of their medications attached to that. So, in the event that somebody came into the home and couldn't find your kit, there's still at least a list of medications that are up to date with the timing and everything on them. So 6 steps to optimum care at home. This kind of goes back to your planning in your wear and care kit. So here's your making your plan so that you're prepared in case anything would ever happen. So make sure the contents in the kit are completed and up to date. That's the first thing that you can do. Also, I'm hoping so. I would assume that everybody with Parkinson's already kind of has pieces in place. So you've got like a neurologist in place. You've got a family physician in place. You have a hospital in your community that you go to if you need to, or in clinics as well. But get to know the hospitals in your community before you need one, in case you've never been to a hospital, or maybe you've moved into a new community and are not familiar with what is there. So before you need to go to a hospital, get to know what's in your community so that you can make an informed choice. Map out where you will go if an emergency requires you to go to a hospital, so you can let medics come, know when they come that I go to Cambridge Medical Center, and so that's where my physician is, my neurologist is there, so that's where I want you to take me. So those are good things to know ahead of time. So it is your right as a patient to ask questions, ahead. So always advocate for where it is that you want to go if you need to go to a hospital. Medication form, we've already talked about this several times, and that you can get extra copies from Parkinsons.org. The nurse disease fact sheet pad, it's just really good information for nurses. We have handed out several of the things in these kits to students. When we talk about Parkinson's disease in class, the students are very aware of this Aware and Care kit. We've talked about the different forms to fill out. They've been given a scenario and have asked the patient with Parkinson's disease in this scenario, who is with a care person. There happens to be the wife in this scenario. The nurses then talk to them about their medications. They look at the form that the family filled out. They verify the medications. They read through the information that the patient gives to the nurse about what the nurse should know. It's just extremely helpful. And then again, we talked about the magnet. That's can be used in the hospital setting. A lot of people use it at home with some of their information tagged right to the refrigerator. Okay, so I lost myself here, so hang on. Okay. So steps 3 and 4. So each time you're asked about your medications that you take, provide the form. Just keep handing them off to everybody. If you brought your medications with you in their original bottles, let the nurses and the doctors know that, because they will make sure the pharmacy gets those so that they can go through your meds, make sure everything is accounted for, doses are right, everything matches up. And then ask to see a patient advocate. If you are feeling as though you need additional help while you're in the hospital setting, they are available. There are on the floor in most hospitals. Actually, there are patient. They call them different things in different hospitals, but they're like patient care coordinators who answer questions, advocate for patients, make sure that they have everything that they need while they're there. So that is always somebody that you can fall back to. And then step number 4 basically goes back to the get moving. As soon as after your medical procedure, if you were there for something scheduled, or as soon as if you're admitted, and as soon as possible, it is vital that you get out of bed and start moving. We want to try to prevent problems with rigidity and mobility and that high risk of falls. Ask for physical, occupational, or speech therapy depending on your symptoms and your needs. Oftentimes, I have to say these are usually put into place early on by the medical staff, but if you have not seen somebody, at least by the next day when you're there that morning, you need to ask. So they can do a lot to evaluate if you need any more mobility pieces of equipment at home. They can evaluate your mobility needs, talk about speech, and help with your activities of daily living if you're having any issues. So stay on top of your care. I think people in general, just from my own nursing experience, I think people are much more willing to advocate for themselves in hospitals. It's not like it used to be where you just sort of let it happen while you were there. It's really essential to pay attention to your medications, the treatments, and the tests that you get throughout your stay. When they come in with medications and it's something that is not normally on your list, please make sure to ask, what is it for? Check it with your list to make sure that it's something that you can take. If it's not on your list, and if it's not on the contraindicated list, then I would even go so far as to take it back to pharmacy, because they can research that for you and they'll be glad to do that. So just being really on top of your care and paying attention to medications in particular. And then also to contact your Parkinson's physician and your primary care physician and give them a progress report. Depending on the hospital system that you're in, they may be consulted to actually come in and see you while you're there. I know the last time my father was in the hospital, his neurologist was consulted, and she came the next morning. So oftentimes that will happen. If it doesn't, then you need to ask to see if that's something that can happen while you're there. So contacting your Parkinson's physician and your primary care physician after you leave, for example, if maybe it was a scheduled procedure that was quite in and out, let them know how things went and give them a progress report. See if they need you to come in for any follow-up, things like that. But if you're there without being scheduled, really advocate for minimally at least having your neurologist know that you're in the building, okay? So this is your Go Kit. This is hopefully you will find very helpful to getting you organized, especially when it's an unplanned visit, because at that point that's not a time to try to start figuring out what I need to bring. And so organize ahead of time, have it in a place where it's easily accessible, everybody knows where it's at. Let family members know so that you can pick it up and go with it, because it will have everything in it that you need. Okay. So just kind of to talk a little bit more about Aware and Care, it's really a national campaign, and our goal is to prepare and empower you and your caregivers so that you can advocate for yourselves in the hospital setting and have just a better overall quality of healthcare experience. So using the tools and the information in the kit is going to help providers, educate your healthcare providers and the staff to help you with your Parkinson's to get the best possible care while you're there. And I think every staff member wants to make sure you get the best care that you can while you're there. It's just sometimes a lack of education in those particular areas. So learn more. You can go to the Parkinson.org site. The link is right here. Living with Parkinson's, research or resources and support, patient safety. And there's lots of things that you can do. You can watch the archived Aware and Care webinar. You can download support group discussion guides. You can order a kit. They're free. So feel free to go on and order your patient safety kit and spread the word to some of your other friends, other people that you know with Parkinson's. If maybe perhaps you belong to support groups, let them also know that this is out there for them and that it's free to all. So you just need to go on and request a kit. We also have, with our Aware and Care initiative, what we call Aware and Care ambassadors, and they educate the community. So if people with Parkinson's know what they need, they're more likely to get appropriate care. So educating clinicians who treat Parkinson's, if clinicians help spread the word about resources, we can share them with more people with Parkinson's. And then educating the hospital staff. If staff know what people with Parkinson's need and why, then they are more likely to adjust the care that's given. So these Aware and Care ambassadors are highly visible, and their goal is to educate the community, the clinicians, and the hospital staff. So about the Parkinson's Foundation, I can't see everybody in the audience. I wish I could see people because I could ask you to raise your hands. I could ask people to share stories or experiences. But the Parkinson's Foundation, if you haven't been on that site, then go to their site. There is so much information out there, and the Parkinson Foundation makes life better for people with Parkinson's disease by improving care and advancing research toward a cure. So in everything we do, we build on the energy, experience, and passion for our Parkinson's community. So there's online Parkinson.org, or you can call the Parkinson's Foundation helpline and get information that way. There's so much information out there, and I think it's available to everybody. So I think the biggest takeaway is to get a kit if you don't already have one. And if you have one, take the time to complete your kit so that it's a go bag and it's ready if you ever needed to leave for the hospital. And know the facts. Learn as much as you can about your disease process and about the medications and about the mobility issues, and teach those things then to others, and be aware in your care. Also, individuals, there's a lot of people to thank who support this program. The Edmund Safra program in particular, where I got my original training. I think there is a wealth of knowledge probably in your communities wherever you live see what's out there for Parkinson's and Parkinson's clinics. I found out when I went to training that there was actually a clinic here in Minnesota who treats Parkinson's disease and movement disorders. I had no idea they were here. Simply amazing. There are so many ways to get involved with support groups, bicycling groups, boxing groups. They have boxing. And then the name of it escapes me right now, but it's boxing specifically for Parkinson's patients where they, you learn balance and mobility. They had so many cool things. It was really fun to be there. So I'm pretty much, I think, done with my presentation, but I would love if there were any questions. Anybody wants to tell a story, give some feedback, or if anybody has the kit in their possession at this point, are you using it? What would you like to see different? I mean, we've been working on these kits for several months, trying to improve them and make them better. So if there is anything out there for anybody, I would love to field some questions.
Thank you, Debra. We did have a few comments from people who do have kits. Someone with 2 kits, one in the car, one at the front door, which is really excellent.
Yes.
Just so everyone knows, I imagine most, if not everyone, logging on today is in British Columbia. So if you're wanting to order a kit, you can do so through our website. I've included the link in the chat box there, but I'll also include that in my follow-up email. There was a comment about keeping up with medication timing changes. So if you filled out a sheet with your medication timing and that changes, we do also have more sheets available for download on the website. So you can print those off to update your medication schedules. So like Debra was saying, if you have any questions or if you want to share any stories, please do type that in the chat box. The question about traveling and if there's a website listing Parkinson's groups in other countries. If you're looking for Parkinson's groups in other countries, I would suggest trying to find out what that Parkinson's organization is called. So if you're in the United States, for example, I think Parkinson Foundation would have that information, but you would have to look for that site for that country. I don't think there is one central website that would list all the groups for all the different countries.
I don't think there is either, but that's a really good question.
So if we don't have any more questions for today, we will be wrapping up. I want to thank Debra again for taking the time to speak with us today on the topic of hospitalization. I think that's a very important topic, and I'm hoping everyone has some good takeaways from our webinar. And again, if you would like to order an Aware and Care kit, please visit our website. I will send it again one more time into the chat box. And I also want to thank everyone for taking the time today to log on.
Thank you.
I hope everyone has a good afternoon.